We have with us today Dr. Swati Watwani. She's an esthetician and a cosmetologist with expertise in skin and hair health, hygiene, and beauty. She's the medical director and chief consultant of Persian Lily, which is based in Maharashtra. We are very thrilled to have you here for yet another live session, Dr. Swati.
Absolutely. Even I'm excited for one more live session with you guys.
Yeah.
Last time we had did it on acne and
Exactly.
a skincare routine for acne. Yes.
Yeah.
Correct.
So we'll be having more of these lives in the future also with you.
Sure.
So shall we begin?
Absolutely. Yes, we should.
So I'll begin with what is diabetic dermopathy and how can a person differentiate it from other skin conditions or rashes that may occur in people with diabetes?
So, unlike every other symptoms that diabetes comes along with, for example, you might have heard that diabetes comes along with diabetic retinopathy, diabetic neuropathy, diabetic, you can say nephropathy. Okay, so eventually diabetes in a long run, being a chronic ailment, affects one by one your organs. And skin, being the largest organ of your body, is also not spared. Okay, so the differences and the changes in the skin texture, skin tone, and skin, you can say, anatomy that we see over the period of time in patients who have been dealing with diabetes for a very long period of time, that is called as diabetic dermopathies. Now, specifically, the most common diabetic dermopathy that we see is the skin changes that we see on the legs. So if you ask me about in a very simple language what diabetic dermopathy is, so these are small, round, oval, pinkish or brownish patches which start appearing on your shins bilaterally on both of your shins, and as the disease progresses you start seeing them on your thighs, on both of your arms as well. Now these patches initially might look like scars. They are also indented to some form. So initially people might feel ki kuch lag gaya hoga, or there might be some injury, so because of that I'm getting such patches, but eventually these convert into age spots and they get darker over the period of time. So that is what we call as diabetic dermopathic lesions. Now, you asked me that how it is different from other skin conditions that diabetic people come across. So a lot of conditions such as very common would be fungal infection. Now, fungal infections mostly occur in the inguinal parts or the intimate areas of your body, where your body is more prone to sweat, more prone to, say unhygienic conditions. So that is where you see fungal infections happening in diabetic patients between the toe skin, interdigitally and all of that. But whereas diabetic dermopathy is mostly seen in the front of both of your legs. Secondly, unlike other skin problems which are seen in patients of diabetes, it could be itchy skin, cracky skin, skin infections, etc. Diabetic dermopathy has no symptoms. It's absolutely harmless. It does not have any pain. It does not have any itching or any painful blisters or any pustules, anything, no infection. These are just circular round oval shaped lesions which appear over the period of time. Gradually they become darker and might progress to the other parts of the body.
Okay. So are there any specific skincare products or routines that can help improve the appearance? As you said, like they look very distinctively. So are there any skincare products that can improve the appearance of these patches on the skin?
Coming back to what is going to improve, to understand that we need to know why it does happen. So as diabetes affects all your organs, as I said, it also affects your minute blood vessels which are running across your skin, under your skin. So it affects your blood vessels, and because of that eventually we also see the aging of these blood vessels, because of which there are these spots on the legs. So the first and foremost thing is to work on the circulation. You have to maintain a good exercise profile. You make sure that you are exercising on regular basis. You are having a low carb and a low fat diet, which does not, affects your blood vessels and further gives you more spots in future. Secondly, when it comes to a skincare routine, yes, few things diabetic patients should always adhere, which I always say, that avoid anything or exposure to too hot or too cold conditions. Okay, because
Right.
that can lead to trauma of your skin, which can further lead to such spots ahead. Okay, so you have to always make sure, like for example, if you're taking a bath, you have to make sure it is not very hot water or not very cold water. It has to be lukewarm water. After
Mhm.
coming from bathing, when your skin starts feeling very tight and dry, make sure you're applying moisturizer at least twice a day when your skin is little bit moist. So any good moisturizers which have ceramides, butters, olive oils, jojoba oils, which can help to keep your skin barrier intact, which can help to keep your skin moisturized, is gonna work, because eventually it's gonna help improving your skin texture and the fading out the spots. So this
Okay.
would be something which you can do over the counter. You can also, if at all you're someone who likes to wear clothes, short clothes and all of that, specifically in women, if you're wearing skirts or something like that, you should consider, of course, application of a sunscreen, which is very important. And as I always say, prefer bathing with very soft bars. You can prefer Zindet bars. You can also prefer very gentle cleansers rather than going for very high pH soaps. So that is what you can prefer. Elsewise, you can also just prefer a colloidal oatmeal or a oatmeal, pan, something, paste for bathing or for, using in that particular area, which is also going to give a little bit of mild exfoliation, but at the same time, it's not going to give a lot of dryness to that particular area. So, and
Right.
then coming to the lower areas of your legs, if you feel there is a lot of dryness or cracking or itching, you can consider moisturizers which are rich in urea, at least 10% or 20% or 30% of urea, which has, you can consider such moisturizers as well.
Okay. So, as you mentioned, discussed about these lotions and moisturizers, are there any ingredients that people should avoid while, getting those moisturizers and lotions?
Yes, so very important is to go for fragrance free moisturizers, because the fragrant oils and all of that which is added to the moisturizers, to the cosmetic products, to give it a typical scent, that is not required, because we are dealing with a diseased skin. So we have to go completely fragrance free, non allergy free. So we have to go for completely unscented moisturizers. That is a very big. Also, you could avoid products which have more amount of parabens, more amount of sulfates and all of that. But parabens is a very big no-no when it comes to extremely dry skin. Okay. Also, you should not consider lotions which have a lot of actives together, such as lactic acid, or a lot of, you can say, alpha hydroxy acids. You should avoid all of that. Rather than that, prefer for the ones which have coconut oil, jojoba oil, olive oil as a base, coconut oil as a base, virgin coconut oil, especially if it's a young diabetic patient also. And you can also consider ceramides, 1 2 3, all types of ceramides, all type of butters. These are the go-to when it comes to choosing a moisturizer for a diabetic person.
Okay. So, before we continue further, I would like to tell you and our audience about our diabetes community on WhatsApp. So, if you're serious about diabetes management and eager to connect with like-minded people, join our supportive community of individuals like you. Simply drop a message saying I'm in the chats, and we'll make sure you get an invite. Or else you can find the link in our bio. So, moving on, can wearing certain types of clothing or fabrics aggravate or irritate these patches due to, or as a whole, diabetic dermopathy?
See, I wouldn't say like directly it would aggravate these patches, but indirectly, relatively, it can definitely irritate your skin. It can make your skin further itchy, irritated, and inflamed, which can further lead to scratching, peeling, and
Hmm.
micro injuries on your skin. And when these micro injuries heal in diabetic patients, they will again leave such spots. So
Okay.
yes, fabrics such as polyesters, nylon are a big no-no when it comes for diabetic patients. You should always, my go-to is pure 100% cotton, because cotton is very soft, breathable. Secondly, you can also consider silk, especially because being soft, breathable, and at the same time silk is very antibacterial.
Okay.
Nowadays there is a lot of microfiber clothing available in markets. You can consider microfiber clothings as well. Then you can also consider merino wool, specifically now in winters. If you are purchasing winter clothes, you can consider merino wool. That's a good fabric to consider in diabetic patients. So yeah, these are
Okay.
my recommended: cotton, silk, merino wool is good. Also microfiber clothing is fine. Polyester, nylon, all these are a big no-no if you are already someone who is having diabetes and is having itching or any other symptoms like that.
Okay. So, how does blood sugar, managing blood sugar levels, controlling it, uh, impacts diabetic dermopathy?
See, keeping your blood sugar levels in check is utmost important, because eventually if your blood sugar levels are not in control, it is gonna affect your blood vessels, and your blood vessels
Right.
is gonna lead to further aging of your vessels, which is gonna lead to further impairment of microcirculation of your micro vessels, and which is going to further lead to diabetic dermopathies. Not only specifically diabetic dermopathy, it can also lead to other skin problems as well
Hmm.
eventually. Okay, so keeping your blood sugar levels in check is very important, because eventually it's going to maintain the health of your blood vessels, and your blood vessels is something which supplies the blood supply to your, you can say, lower part of your skin, which is the lowermost layer, that is the dermis. Your dermis is rich in blood vessels, nerves, etc. So having a good blood circulation, having a good nerve supply is utmost important in patients with diabetes, and that is only possible if you have a good blood sugar level check. If you are maintaining your sugars, you are checking them time to time, you are monitoring it, you are adjusting your doses, you are adjusting your diet accordingly, you are modifying your lifestyle, exercise, etc.
Okay. So, are there any strategies or products such as makeup or camouflage techniques that can help conceal these appearance of these patches that happen due to diabetic dermopathy?
See, always my go-to is gonna be a moisturizer. That is very important. Your base is always need to be a good thick moisturizer, because that is eventually gonna protect your skin. That is eventually gonna
Right.
protect the barrier system of your skin. Of course, if you want to camouflage, you can always go for camouflagic products. Cosmetically, if you ask medically, you can consider some medicated primer creams. You can consider medicated foundations. Lot of vegan foundations, lot of natural cosmetic products are there to conceal, to camouflage it. Also, if you want to go ahead for procedures, there is a procedure called as pulse dye laser, Q switch lasers, which can be considered in patients who have very chronic lesions, and if the pigmentation is bothering them a lot. Over the counter, this much only. When you go to a skin doctor, you can ask them for procedures. They might prescribe you creams such as hydrocortisone, because that is something which is going to help to kind of improve your spots. Also very mild exfoliant creams which have lactic acid, urea, and a combination of that, which can further work as a very good exfoliating, but at the same time does not dry out your skin. It is gonna keep your skin, you can say, it works like a humectant. So your doctor will prescribe you that. So that is something, rather than going for camouflagic treatment, of course I would say to visit a doctor and get done a proper treatment for that. But yes, if you are going for emergency, say visit somewhere or traveling or something like that, you can consider camouflagic options as well.
Okay, so I mean, do you think the products that we usually use that are available in the market, the makeup products, do you think उसका कुछ गलत असर पड़ सकता है, मतलब साइड इफेक्ट्स हो सकता है for people with diabetes?
See, most of the makeup that today is available in the market is a very high coverage makeup. It is a makeup which has a lot of minerals which do not work on a diabetic skin, because diabetic skin is a skin which has undergone a lot of changes because of microcirculation. So your skin is not open to adapt that high concentration minerals basically. So I would say always, even if you are someone who uses makeup and who really is much more concerned about camouflaging it rather than going for a proper treatment, you can always do a patch test before, whatever be the foundation or a concealer or whatever creams you are using to camouflage it. First always get done a patch test. If it works well, you can go ahead and camouflage it, but always make sure a primer or a moisturizer is a base. You're first applying that, and then only over that you're applying whatever the camouflaging cosmetic products. Even when you are back home, make sure you remove it with micellar water, you cleanse it with a gentle cleanser. Again, you are layering up with a moisturizer to avoid further damage of the skin.
Okay, so that was all from my side. Let me check once. Okay, there's one question which is completely unrelated to this, to our discussion. So yeah, no, I think we've covered everything. No one has asked any question, and I think we have covered everything in detail. So
That's great.
that's yeah. So मतलब हमने कोई डाउट्स का स्कोप नहीं छोड़ा आज हमने अपने पूरे डिस्कशन में.
So I think all
So
the diabetic patients are very satisfied now.
हाँ,
They are good to
I hope
go.
so, and I'm expecting that after listening to this whole session. Thank you again, Dr. Swati, for joining today's session. And for all the collaborations that we, like all the things that we work on together. A
Absolutely. It was a
huge
fun
thanks.
session. Diabetes has always been my favorite subject when it comes to skincare, because that is the most common patients that we deal day to day, and these are the patients who need a lot of precautions. They need to be guided well. They need to be made well aware about their condition, about how their skin is different from normal skin, what all precautions they should be taking, what all things they should be avoiding, you know. So yeah, that is like, you know, specifically diabetic patients are some people who come who are above 50, and especially in winters they will always come and, you know, tell you that, you know, so we use like very hot water for bathing, which is a very big no. It can actually give you scars, it can actually give you more micro injuries to your skin. So these are very basic tips that, you know, patients need to be aware that, you know, any kind of very hot or cold trauma is not at all good for a diabetic skin.
Okay, thank you so much again. That one question that Chinmay Bavaskar has asked is that, can you please tell me how to control sugar intake level? This is, I think, is a question for a diabetologist, I guess. That would be a better person to answer.
As a skin doctor, I can only answer is control sugar to control the sugar.
Exactly. So,
the endocrinologist is the right person to guide you.
Exactly. So, Mr. Chinmay, our team will reach out to you with an answer of this question and we'll get the answer from a diabetologist and we'll get back to you. So, once again, thank you, Dr. Swati, and to all our viewers. Thanks a ton for being a part of this session. At THIP Media, we are dedicated to delivering expert health information for your well-informed choices. Stay clear of unreliable health advice on social media. Follow the Healthy Indian Project on WhatsApp and other social media platforms for trusted health updates. Remember, when you know better, you live better. Thank you. Stay safe and healthy, and good night.